Good afternoon, reporting here from Western Sydney University. I'm Shifa and I'm joined here by my fabulous team members, Pranisha, Sabina and Pranisha. Communication is an important skill that is simultaneously the sincere intention of the nurses to understand what concerns the patient. The image shows the 6 different components of communication skills that include listening, friendliness, open mind, feedback, confidence, and non-verbal communication. Handing over to the girls who will discuss what are the most valuable top 3 communication skills. Kamisha?
One of the best ways to communicate is through listening carefully. Active listening involves paying close attention to what the other person is saying, asking clarifying questions, and rephrasing the other person's words to ensure clarity.
So what you are saying is that when we practice active listening, others can understand the speaker and are able to reply adequately.
Indeed, that is an example of active listening right there, Sabina.
Clarity and conciseness are essential components of verbal communication. It is a guide to effectively convey an argument using fewest possible words to be precise and explicit in what you want when communicating. Pranisha?
A person's body language, eye contact, and body gestures and tone of the voice all affect the message that are trying to express through nonverbal communication. It is important as it can make an individual look more approachable and encourage others to chat honestly. Heading over to Sefa.
Thank you, girls. On today's agenda, the explanation of our findings of the case study is in the misconduct found, actions that the nurse has made in demonstrating the awareness of responsibility and the effects of choices, actions, and behavior, and communication strategy in which the nurse, Mr. P, could have complied with in the role of nurse. Briefly identified by Sabina is the misconduct in the case scenario.
From the case study, Mr. P made the following misconduct, which is parallel to the Code of Ethics and Conduct of Nurses and Midwives Association. Mr. P made a claim that he has a postgraduate qualification and experience in intensive care. He also made a racially and culturally offensive statement on social media. He shared private information of patients to other family members without seeking consent of the patient. He falsely altered patient notes indicating they have been administered medication even if they have not. And lastly, there is ineffective communication between the patient and Mr. P. Defined by Pranisha, actions that the nurse has made in demonstrating the awareness of the responsibility and the effects of choices, actions, and behavior. Pranisha.
In this scenario, the nurse demonstrated an absence of proper understanding of how accountability impacts decisions, actions, and behaviors inherent in the role of the nurse. The following actions are what the nurse could have applied to demonstrate professional accountability. Respecting patient confidentiality and privacy. The nurse could have taken steps to protect patient secrecy and concealment by avoiding sharing confidential information on social media or with unauthorized individuals. This denoted his knowledge of responsibility to maintain patient discretion and respect their privacy. Being lazy in the job application, the nurse could have accurately represent qualification and experience in the job application, which would demonstrate his understanding of importance of being accountable for their actions. Considering the dignity and value of nursing profession, he could have truthfully and honestly shared his involvement and deeply in the related field. His truthfulness would have created good communication and faith and confidence. Reflecting in empathy, Mr. P could have empathized the condition of the person and helped him to improve his mental health and stress. Basically, lack of empathy on him and his true behavior could be problematic for his career and mental health of patients and their family as well. Assessing permission. The nurse could have obtained informed consent from patients before performing any medical procedures or administering medications. This would display his understanding of the importance of reporting in ensuring that patients receive appropriate care and treatment. Sustaining errorless medical records. The nurse could have ensured that medical records are error-free and complete, including documenting and medications administered and obtaining consent. This will reveal his understanding of the importance of liability in providing appropriate care and treatment to patients. It also helps in maintaining the trust between the patient and healthcare worker, being complimentary and kind to the clients and their family. Mr. P made hurtful comments on his Facebook account, which were easily visible to the crowds. A superior nurse must avoid making any offensive comments that could harm the fame of the nursing profession or cause harm to the victim. Overall, demonstrative amenability requires a nurse to act in the best interest of their patients, respect their confidentiality and privacy, obtain informed consent, and maintain accurate medical records. Effectively identified by Pranisa and Siva, the communication strategies in which the nurse could have compiled between 2012 and 2013 that reflect respect of a person's dignity, culture, values, beliefs, and rights.
According to Paul Page, person-centered approach is a type of communication that includes the person and family members in all aspects of communication process. It occurs for specific purpose, characterized by unequal sharing of information and seeking permission and approval from the person involved. Mr. P could have used the characteristics of person-centered approach to involve the family or relatives in sharing of confidential information by seeking permission and getting approval from the patient. Through the use of person-centered care, the nurse could have applied to deliver sensitive information to family members, which further shows the respect for dignity, culture, values, and belief, and the right of the patient by actively involving them in the decision. It further depicts which information is allowed to be shared based on the patient's preferences to relatives that enhances their dignity and respect. Obtaining consent. According to the International Council of Nurses, by obtaining consent before disclosing any information, healthcare providers can preserve the privacy and confidentiality of patients. There are two ways of obtaining consent, formal and informal, both of which are ways of communicating effectively. Mr. P, the nurse, could have used obtaining consent with his patient whilst providing care to ensure there are no miscommunications between nurses and accuracy for patient notes, which will further ensure confidentiality and maintenance of person's dignity.
Using translating services, nurses are providing patient care across a range of culture and linguistic contexts. As a result, each patient needs to be cared for as distinct persons, whilst considering their cultural demands is a requirement of intercultural nursing. The nurse in the case scenario could have used effective communication through translating services for patients from culturally and linguistically diverse backgrounds if needed. Through the use of translating services, it would enhance the person's dignity by providing what is needed in order to provide optimal care. If the nurse has used translating services, the patient, family, and caregivers would be able to identify their respect for their culture and beliefs while recognizing their rights. By using translating services, it further allowed to reflect to value individuals and their beliefs through understanding by promoting communication to provide best care of the patient.
Effective documentation. Each patient or client's incident or treatment or contact with healthcare providers must be accurately recorded in the documentation in healthcare records according to the International Council of Nurses. Effective documentation is a type of communication in which is a necessity for professional healthcare workers for safe, quality, evidence-based nursing practice. The nurse in the case scenario could have used a communication strategy to ensure that appropriate information was recorded for patients. It allows for promotion of patient safety, support, and confidentiality of information when a patient is under care of different nurses. As a result of effective documentation, nurses writing complete, factual, concise, and timely organized documentation. It promotes the rights of a patient as well as respecting their dignity by maintaining privacy and confidentiality through effective documentation.
Reporting obligations under national law and other relevant legislation, such as Mr. P has been entering wrong details in reporting, such as he has mentioned that he gave medication when he didn't do in real. The nurses should practice honestly and ethically and should not be engaging in unlawful behavior such as sharing patient details to family members as Mr. P did in this case scenario.
Previously in the case study, Mr. P had breached guidelines referring to the Association of Nurses and Midwives Codes of Ethics and Behavior.
The nurse revealed an inadequate level of awareness of how responsibility affects the choices actions and behaviors that are essential to the child.
in which a nurse must work in the patient's best interest to protect their privacy and confidentiality, acquire informed permission, and keep correct medical records in order to demonstrate accountability.
The communication techniques in which that the nurse may have used between 2012 and 2013 to show respect for another person's dignity, culture, values, beliefs, and rights include
Person-centered approach, obtaining consent, using translating services, effective documentation, and legal obligation.
Signing off, student nurse Shifa.
Pranisha.
Sabina.
And from
Till next time, thank you and good evening.
Bye.